Sticks. Introduction. A 2-year-old girl is brought to the emergency room with a red mark on her leg. She's too young to explain to anyone what happened to her. Her parents believe some kinds of animal bit or stung her. How does an emergency room doctor identify the culprit that caused her injury? June McNally is the manager director of Arizona Poison and Drug Information Center in Tucson, Arizona. He studied things that are poisonous or harmful to our bodies. Let's talk with June to learn about bites and stings in the dessert. Life-threatening bites and stings. Interviewers. What happened first when a patient such as this young girl is brought to the emergency room? Jude. The doctors look for symptoms of life-threatening bites and stings. They are looking for symptoms that caused by 4 possible, like widow spiders, moths, insects that fly and sting, and rattlesnakes. Interviewer. What do doctors look for in the case of black widow? Even though all spiders produce venom, one of them can get the venom into people, but the black widow spider, especially female black widow, can inject venom when it bites. Black widows cause a burning, stinging pain at the site of a bite. There's not much swelling to cause it a major spasm. Wounds. Merely scraping begins usually in the area of the sting, and is basically bad in small children. A child will get muscles cramping all over his or her body. Sometimes the belly looks just stuffed like a board, and sometimes breathing becomes difficult. Children can also get puffy eyes. We rule out black widow spider bites when there isn't any muscle cramping. Interviewer. What symptoms would you use in case of a scorpion stings? There are 30 different kinds of scorpions in Arizona, and only the most common can be life-threatening. A 2-year-old child stung by a moth scorpion will be restless and won't be able to sit still. We often see muscles twitching, especially around the mouth. Another obvious symptom is falling eye syndrome. Will not be able to focus the eyes, and will see the movement disorders. Where a child will look as he or she is doing a strange dance. Other scorpion stings cause local swelling, but the most scorpion cause almost no reaction at the site. With a 2-year-old child, we do a tap test. We run our fingers up and down the child's body. He or she will scream when the child stings because it's so painful. If we look carefully, we can sometimes see a single puncture wound. We rule out scorpions with relentless twitching and roving eye as syndrome or accent. Interviewer. What did you look in case for? Flammable stinging insects. With bees, wasps, and ants, we consider about children's erections. Most people get some practice itching or squealing at the sight of a sting that go away in a couple of days. But other erection, other than the sight within the first hour, is considered. A type 1 allergic reaction can be life-threatening. We say this happens within an hour, but usually within 20 to 30 minutes if you know you're allergic. For example, if someone starts to have breathing difficulties, that's a big concern, or if you're stuck on your back and your hands are itchy, if you stuck on your leg and have big trouble swallowing, those are concerns of those mean that the whole body is reacting to the sting. This type 1 reaction needs emergency medical care because the patient can die. More people die from insect sting than from black widows, scorpions, and rattlesnakes combined. That's how important it is to rule out allergic reactions to fly, stinging insects. We rule out the allergic reaction by assessing the patient's ability to breathe, as well as by testing his or her blood pressure. An allergic reaction causes an extreme drop in blood pressure. Interviewer: what symptoms do you look for with a rattlesnake bite? It's not easy to rule out a rattlesnake bite right away because the disease happens in stages. It begins with puncture, ground, possibly with some bleeding. Then you start to see swelling and discoloration at the site of the bite. Hours later, you might see skin blistering. You can also have tissue destruction, meaning the skin and muscles tissue dies around the site. Bruising that travels over the body is definitely a sign of snake bite. We draw blood and we measure the parts of blood that are responsible for clotting. Snake's venom destroys those parts of the blood, so a snake-bite patient starts bleeding inside, which makes tissues die. All this happens over 24 to 36 hours. During this entire time, we give the patients antidote to try to stop the body's reaction to the venom. Math minutes. Rattlesnake antidote costs a patient about $3,000 per vial. One patient was in the hospital for 10 days and received more than 10 vials of antidote, along with the other hospital expenses. His bill totaled $326,000. How much did he spend on antivenom? How much did the rest of the hospital expenses cost? On life-threatening bite and sting. Interviewer: now let's talk about animal skewches that don't cause life-threatening symptoms. What symptoms would you see with a bite from a Gila monster? A Gila monster bite will usually create a little row or circle teeth, more rather than a single punch-down wound. About the third of teeth are embedded in the wound. It's very painful bite because the Gila monster hangs on for a very long time after its bite, half a minute or more. We say that most people who are bitten by a Gila monster deserve to be bitten. The Gila monster is a very docile animal, and most people who get bitten are harassing one. Interviewer: what about scorpions other than the boss scorpion? If not the boss scorpion, swelling often develops at the site beginning few minutes after the sting. The patients will feel pain at the site and they may more some tingling and numbness, but it usually goes away in hours. The swelling is a clue that it is not a box scorpion sting. With boss scorpion, no swelling occurs. Interviewer: what kinds of symptoms do you see with spider bites other than from black widow? When most other pirates bite, the venom produces local inflammation, but usually no full body symptom. And other spider bites, we pay close attention on brown rosy spider. Often you don't feel the bite, but over the next hours, blisters from the site. Eventually, the blister breaks open and scalp forms and tissues die. This can cover a large area and it can last for weeks or months. Recluse spider bites usually on a big pause of their outages in the emergency room because the system takes time to develop. Aside from black widow, brown legs good spider. All spider bites won't cause any problem unless the bite gets infected. Interviewer. Now what about other snakes? There's are more venomous than venomous snakes, or lots of snakes we call non-venomous actually have venom, but their bites isn't a serious health risk. It can make us sore and one in a while blisters and swelling develop at the site, but nothing serious. It's estimated that in the United States that there are over 55,000 snake bites each year, and 6,000 to 8,000 of them are venomous. Conclusion. Do you have any advice for readers? Besides rattlesnakes, almost all the bites and sting we deal will happen in around people's home. Spiders and scorpions are active at night. They seek a dark crack or receive during the day. You're more likely to come across them at night when they're active. So turning on the lights at night would reduce your risk. If you see some dangerous and take one step back, so easily remove yourself from the range of danger. And if you leave the animal alone, you lower the risk. More than half people will treat for rattlesnake bite saw the snake, recognize the danger and put themselves in the greater risk. If you make small choices, you're much more likely to stay safe.
Good job!